Mm, mm, Very good. Mm. So, hello everyone. Good afternoon. Myself, I am Dr. Aviteja, laser and laparoscopic surgeon, Honest Robotic Hospital. So, today we are going to discuss a topic called daycare hernia surgery, patient selection and safety protocols. So hernia is a common procedure, general surgical procedure. We all know that hernia occurs because of increased intra-abdominal pressure. There are some weak points in the inguinal region, lumbar region, umbilical region. Through that weak points, whenever the intra-abdominal pressure increases, this leads to hernia. So then hernia can be treated laparoscopically or through open surgery. So hernia can't be treated with medication. That is the one most important thing we need to understand. So hernia can be treated only surgically. So now coming to the daycare hernia surgery, patient selection and safety protocols. Why daycare? So daycare helps in like the patient can go and start his or her work immediately within 1 day or 2 days, because we all know as of these days the IT jobs, all most of the jobs are from work from home, so they can start their own work. That is the most important thing. So hernia repair in which patient can be done in daycare procedure. So the patient selection and the criteria of patient selection is very much important here. One, inguinal hernia. Second is umbilical hernia, and small ventral hernias can be done in daycare procedures. Now, how the patient is selected? The cornerstone of safety here is in patient selection is most important thing is we have patient factors and hernia related factors as well. So what are the patient factors? One is age, because in old age patients we can't discharge them immediately, so age is very important. Below 45 or 50 years or below 55 years we can choose, not up to 60 years, more than 70 years we can't choose them for daycare procedure. Then coming to, there will be a grade called ASA. That ASA grade, if it is under 1 and 2, then we can select the patient for daycare procedure. And controlled comorbidities like diabetes and hypertension, if they are controlled, BMI preferably less than 30, because obesity patients may get complicated post surgery because of pleural effusion or because of mobility issues. So if the BMI is less than 30, yes, we can choose them for daycare procedure. This is not only for hernia, any surgical procedure. If the patient fits into this criteria, they can be chosen for daycare procedures. So these are one important thing we need to understand is social support and family support for the patient, because only if this is there, only then it is possible, because family is going to play a major role in the support of the patient. So that is one more important thing. When coming to hernia factors, if it is an uncomplicated primary hernia, which is a basic simple hernia. Second, reducible hernias, not irreducible or obstructed type of hernias. No bowel obstruction, no strangulation, And small to moderate defect size. Defect size has to be small or moderate type. These types of hernias, yes, we can do it under daycare procedures. Now, coming to psychosocial factors. Now, patient need to understand the procedure. If he is like apprehensive, anxious about the procedure or the treating process, then it can't be done. He has to be prepared. Ability to return from for emergency if needed, that need to be understood. A reliable caregiver at home, these three are most important psychosocial factors. This helps in patient selection and criteria for daycare procedures. Now, exclusion criteria, who are not preferred for daycare hernia surgery. Like, what is daycare? Immediately we will operate the patient and we will discharge the patient on the same day or the very next day within 24 hours maximum, or under before 24 hours we will discharge the patient. So that needs exclusion criteria because it is going to complicate if we discharge them early. So the exclusion criteria is complicated or strong strangulated type of hernia. Second is severe cardiopulmonary disease patients, uncontrolled diabetes or hypertensive patients, morbid obesity patients, anyone who is suffering from coagulopathy or anticoagulant misuse, poor home support or long travel distance. The support from home or family support is not well, the distance from home and hospital is larger, then this is not going to help. So these are the exclusion criteria. Now, preoperative safety protocols for daycare procedures, detailed clinical evaluation has to be done, basic investigations, checkup, pre-anesthetic checkup, everything has to be done prior the surgery. Like prior 2 to 3 days before the surgery, that will be the best option. Informed consent with daycare counseling, this consent has to be taken. Prehabilitation advice like nutrition or weight loss before undergoing the procedure, this has to be done. So these intraoperative safety measures. Now, coming to, we have taken preoperative safety protocols. Now intraoperative safety measures are much more important, because if we do under open procedure, it may take like 1 or 2 days for the patient to recover because of pain. But laparoscopy, it helps. Laparoscopically patient improves very well within 1 day. That helps. Standardized surgical technique has to be followed, and the size of the mesh according to the defect, it has to be used judiciously based on the surgeon's knowledge. That is very important, because it is because using a huge mesh can cause a lot of discomfort to the patient. And minimal tissue handling, this comes with experience of the surgeon. That is much more important. And strict aseptic protocols, it will not happen everywhere whenever there is a septic type of picture. So asepsis or maintaining the proper protocols has to be followed. Then coming to the post-operative discharge criteria, one is patient has to be hemodynamically stable, pain controlled on oral medications itself. Then he or she can be able to walk and void urine, no excessive nausea or bleeding, clear written and verbal instructions before discharging the patient. These are important post-operative discharge criteria for daycare procedures. Now, coming to post-discharge safety protocols, we have to instruct the patient about the safety protocols post-discharge, like wound care, activity restriction, pain management, early follow-up schedule. Then, and we have to explain them clear red flag symptoms to the patient. Complication prevention and readmission reduction. How we need to prevent complications, prevent readmission. So proper patient selection definitely helps. That criteria we have seen. Adequate pain management has to be done. Prevention of urinary retention is the most important thing. Early ambulation and patient education, these are all to be followed. Then what are the advantages of daycare hernia? Why daycare hernia is important? Daycare hernia surgery. So reduced hospital acquired infections, because in hospitals, say in ICU or in ward side, there will be different types of patients, either pneumonia or sepsis, any kind. So that bacteria can infect the mesh which is present in the which we will keep in the hernia surgery. If the mesh gets infected, it will be horrible. So hospital acquired infections can be avoided. Lower treatment cost. The cost of the treatment goes like almost up to 70 or 30% down when compared to the, like if the patient says 2 days, 3 days, 4 days, the cost will go up. So faster return to daily activities, high patient satisfaction, optimal bed utilization for the hospitals. A future direction, enhanced recovery protocols we are following, that we call as ERAS. So daycare hernia surgery is safe not because patient go home early, but because they are chosen wisely and managed meticulously by the surgeons. So that is most important thing. We will follow this in our hospital, Onus Robotic Hospital. We will follow this meticulously patient selection before discharging, and we will take care of the post discharge process as well through proper communication. So this is much more important, patient selection and criteria and post discharge advices to the patient. So this is about today's topic, daycare hernia surgery selection criteria and protocol, patient selection and safety protocols. So if someone is suffering from hernia surgery, inguinal, umbilical, or small ventral hernia surgeries, if you don't have time, if you want to get discharged within 1 day or 2 days, so yes, we do laparoscopic hernia surgeries, and even robotic hernia surgeries can be discharged within 1 day under daycare procedure. So if someone is suffering from these type of problems, I am Dr. Abhiteja, laser laparoscopic and robotic surgeon, available at Onus Robotic Hospitals. You can reach out to me at any time. I am available here. So yes, daycare hernia surgery can be done with proper selection of the patient and proper exclusion criteria with discharge advices and follow up with the patient. Thank you so much.